Hello and a very good evening, everyone. I hope you all are doing good and welcome everyone for this live session on topic of epidemiology and biostats and screening of disease. See how the things are like we all know that INICET exam, it is known for asking like set pattern of MCQs and there are selected topics which are asked again and again and again. So if you talk about these topics, these have been repeated multiple times. And beta, today's session, it's more almost everything about the previous INICET exams. I'll be talking to you. I'll be discussing all the previous asked MCQs. So keep your pen and paper and make sure that you are fully attentive in the class today, in the session today. It would be a long session today. So I have with me water and everything, and I hope that everybody would have their own resources so that you are able to sit during the course of this session in a much more optimized and attentive manner so that you are able to successfully solve all the MCQs in the exam. That is what my whole intention is, right? So very good evening Shreyam, very good evening Sneha, Kalpana, Abhinandan, Akib Khan, Sherin, Olaf, very good evening. ये बहुत दफ़ा एग्ज़ाम में पूछे गए टॉपिक्स हैं and I'm happy to share with you the today's topic. Let me just yeah. So I'm happy to share with you the today's topic. We have already accomplished, we have already covered all the previously asked topics from community medicine. Like I have covered communicable disease, non-communicable disease, national health programs. I have already covered on 5th of April, we took a video session on mother-child health, vaccines, RCH program, immunization. So nutrition, environment, everything miscellaneous, right? Epidemiology, biostats we are going to discuss today, and there will be another session probably on 26th of April. I'm not sure about this session because we might be doing a bigger INICET recalls and bigger level of INICET quick review program. So I'm not sure about like will we do only pixelosis? Pixelosis is image based questions, beta. So Vijay keh raha hai, yesterday marrow session in YouTube teacher said there were updates which could be important, any information. So of course beta, I have given you all the updates in your marrow application. Marrow ko update karo na. So if you just follow the marrow updates, it's already there. I have a session, it's just 1.5 2 hour session. So wo 2 ghante mein I've discussed all the updates, right? So PSM mein updates are very important, like updates and PSM. PSM is equal to updates. PSM is equal to updates, PSM is equal to water, right? So no FOMO, absolutely correct. Vijay बिल्कुल ठीक कह रहा है. Olaf, what a cute name. Chalo, anyways, today's session I have divided into 3 topics. Of course, the 3 topics are epidemiology, biostats, and screening of disease. And we'll be discussing all these 3 topics. Let me just have a very quick glance at can you tell me how many marks are required to talk about medicine? Beta, if you talk about how many marks are required, decently speaking, in any INICET exam, it's usually seen that roughly if you get score roughly around 180 MCQs correct, like something within 200, you get these questions correct, you get a decent rank. We cannot say that this rank is good for medicine or this is not good, this score is good for medicine or not, but generally it will depend on the difficulty level of the exam, right? So anyways, any other doubts, you're most welcome to ask me during the session. Let's talk of the first topic, that is epidemiology. If you have any doubt, you're most welcome to shoot it even during the session. So don't worry about anything and make sure कि आप ना ये जिद बना के चलो. जिस स्टूडेंट ने भी, any student who has made that passion inside them कि मेरे को ये जिद है, तो ये जिद जब आपके आगे, सनक जब आ गई ना, उस टाइम पे एग्जाम क्लियर होता है. सो मेक श्योर यू गेट दैट सनक. इज डूइंग दिस वीडियो इनफ? अब क्या बोलूँ मैं, मानसी शर्मा, मानसी कह रहे हैं कि इज दिस वीडियो इनफ? अब दैट्स व्हाट, क्या बोलूँ मैं, मतलब व्हाट डू यू वांट मी टू से? इज दिस इनफ, यस और नो? अगर ये इनफ होती तो सब स्टूडेंट्स हु आर who have gone through all the lectures या थर्ड ईयर में जिन्होंने प्रॉपर तैयारी की है, तो वो पूरा मतलब ये लेक्चर 1 hour 2 hour से नहीं ना होता, right? So make sure, I was saying that जिसने स्टूडेंट ने जिद पकड़ ली, if you have that zid, if you have that passion, that student is going to clear. So you are just very few days away from the INICET exam, and let's just hope that God will give you strength to to bear this whole story. महेश सेन, इज दिस हेल्पफुल फॉर एफएमजी? एफएमजी के लिए इतना हाई लेवल, इतने न्यूमेरिकल्स इज नॉट रिक्वायर्ड बेटा. फोकस ऑन योर एफएमजी एग्जाम पैटर्न राइट नाउ. वंस यू आर डन विद योर एफएमजी एग्जाम पैटर्न, उसके बाद दिस मे बी वेरी गुड फॉर योर INICET. Please note that this lecture today is primarily for students aspiring for INICET 2023. Total, I will be covering around 60 to 80 MCQs. Okay, how many years MCQ? Roughly, I would say 3 to 5 years MCQ should be good enough for community medicine like subject, because there are so many updates. You tend to get lost somewhere in the updates if you do very old MCQs. 1990 का कोई क्वेश्चन उठाओगे, 2000 का क्वेश्चन उठाओगे, वो स्कीम ही आजकल वैलिड नहीं है. Mid day meal program is not valid anymore, so they will ask you questions from portion scheme and so on. Let's go on and talk about the first MCQ. Very quickly, you need to read the MCQ and इसको options में आपने click करके अपना आंसर लिखना है. ये आज की एक्सरसाइज है. आंसर लिखोगे, उससे मेरे को कोई फ़र्क नहीं पड़ेगा. Even if you don't write answers, I am not bothered, but if you write answers, it will have that अब आपके ना सबकॉन्शियस माइंड में बेटा यू जनरेट अ प्रोसेस वेयर यू ट्राई टू आंसर एनी क्वेश्चन दैट यू आर फेस्ड विद. अगर ये फोमो रह जाता है, अगर ये डर बैठा रह जाता है ना, या फियर रह जाता है कि यार मेरे को पता नहीं ये क्वेश्चन आएगा नहीं आएगा, एंड यू गेट अ फियर के स्टूडेंट्स, बाकी स्टूडेंट चैट में क्या देखेंगे क्या नहीं देखेंगे, देन यू डोंट गेट दैट हैबिट ऑफ सॉल्विंग MCQs. वो हैबिट जनरेट करना बहुत ज़रूरी है. Let's move on to the MCQ. Which of the following is not a feature of the cohort study? Very easy question. Which is not a feature? गलत वाला बताना है. Which is not a feature of the cohort studies? So what do you think? Which of the following is not a feature? It shows natural course of disease. Yes, this is true. Everybody knows about it. Finds incidence. Yes, this is true. Finds risk ratio. Yes, this is true. From effect to cause, गलत हो गया. It is from cause to effect. It is from cause to effect. It is a very simple direct MCQ. Beta, I am sharing with you. This is a saransh. This is a summary. This is a summary of This is a summary of all the things that you need to remember for your exam. Summary of epidemiological study designs. So take a screenshot of this. This is a 5-star MCQ topic. This is a screenshot MCQ. This is a screenshot slide. इसका screenshot लो, अपने पास ध्यान से रखो. What is cross-sectional, what is ecological, what is case control and what is cohort, I have discussed over here. इस पूरे slide का important MCQ perspective है. I would also like to reinforce over here, very frequently you can be asked questions from clinical trials. INICET pattern MCQ है, 5-star MCQ है. What are phase 0, 1, 2, 3, 4 and 5 trials? So please make sure that usually it is said that हम tolerance check करते हैं, toxicity levels check करते हैं, किस level of study clinical trial में, we check it in the phase 1 clinical trials. Then it is done on some few hundreds of patients in phase 2, thousands of patients in phase 3. So 2 में याद रखो hundreds of patient होंगे, 3 में याद रखो thousands of patients होंगे. How did I remember? 2 में कितने, 2 मतलब 2 मतलब कितने zeros, 2 0. So 2 0 मतलब 100. 1000 में कितने zero, 3 0, तो 3 मतलब phase 3 trials. You can remember 3 मतलब 3 zeros, 2 मतलब 2 zeros. Are you able to follow? 3 मतलब 3 zeros, 2 मतलब 2 0. Hundreds of patient में हम उनका you can say efficacy trials करते हैं. It is efficacy, it's not only in 2 या only in 3. It is done in both. So phase 2 is on hundreds, phase 3 is on thousands, and finally phase 4 कब करते हैं? It is post-marketing surveillance. What happens is if a drug is launched into the market, मार्केट में लॉन्च होने के बाद कुछ देर के लिए we do some long term trials, these are phase 4 trials. Phase 5 trials जो हैं, these are very long term and they are to confirm the adverse drug reactions or very rare side effects which may even happen after 5 to 10 years, like cancer or any malignancy which a drug might promote. So these are results from phase 5 trials. So please remember phase 0, 1, 2, 3, 4, 5. तो इस क्वेश्चन का बड़ा सिंपल आंसर है. The question answer is that it is from effect to cause. बोलो मेरे साथ, it is from cause to effect. The right answer is it is from cause to effect. Incorrect is effect to cause. Let us go to the next MCQ. Again, INICET pattern MCQ है. A research is being conducted to find the association between aniline dyes and exposure and bladder cancer in workers of an industry who have worked for more than 20 years. Two groups were formed directly involved with dye handling and other group with office clerks not exposed to the dye. Years of occupation were noted from the previous record. इस पूरी गेम में जो मेन क्रक्स ऑफ द गेम है, years of occupation were noted from the previous record. This example, this is a perfect example of a retrospective cohort. This is the most recent NEET exam question. Of course, it is the same pattern which can be asked in your INICET exams. This has been discussed very nicely and very elaborately in the Marrow modules, video number 8, 16, 45 minutes. It has been discussed much elaborately. So make sure कि exam के लिए आप पढ़ के जाएं. What do you mean by a retrospective cohort? Yes, beta, this is a NEET exam question. Next is incorrect matches. What do you think is the incorrect match? Selection bias, Hawthorne bias, Bergsonian bias या publication bias, case control study, cohort, hospital based, cross section. So what do you think is incorrect match? Incorrect वाला, गलत वाला ढूंढना है. Selection bias goes with case control, क्या ये सही है? Hawthorne bias goes with cohort studies, क्या ये सही है? Bergsonian is with hospital-based case control study, or publication bias is cross-section study. So which of the following do you think is wrong answer? Incorrect वाला ढूंढना है बेटा आपने. You have to find the incorrect one. So please note that selection bias cannot be found in case control study. Yes, this is correct. Yes, this is correct. Selection bias can be found in case control study. Next is cohort studies में Hawthorne bias. Yes, हमें मिलता है. What do you mean by Hawthorne bias? Hawthorne bias is change in behavior, change in attitude while under observation. So that change in behaviors while under observation is called as Hawthorne bias. Next is Bergsonian bias, hospital-based case control study. Yes, this is also correct. Hospital-based case control studies में होता है Bergsonian bias. MCQ, what do you mean by Bergsonian bias? Bergsonian bias is differential hospital admission रेट्स की वजह से होता है, वेयर द केसेस मे बी इक्वल टू कंट्रोल्स. केसेस और कंट्रोल्स में कोई अंतर ही नहीं रहेगा बिकॉज इट इज़ अ हॉस्पिटल बेस्ड केस कंट्रोल स्टडी. फॉर एग्जाम्पल, यू वांट टू डू अ स्टडी ऑन ल्यूकीमिया. ल्यूकीमिया के ऊपर स्टडी करते हैं, and in case of leukemia, where will you take the cases from? You have to take them from the hospital. Where will you take the controls from? Common sense, if you take the controls from the same hospital, हो सकता है वो patients already कोई और cancer के हो ना, because it will be a cancer hospital. You won't take patients from PHC, है ना, वो तो किसी cancer hospital से होंगे. So there are chances that the cases may be equal to the controls. उनको वो leukemia ना हो के कोई और cancer होता. So that type of bias where the cases and controls almost similar हो जाएंगे, that is called as Bergsonian bias. It is a special hospital based bias study. So publication bias क्या होता है? Publication bias जो है, पब्लिकेशन बायस ये जर्नल्स में मिलता है. जर्नल्स, रिसर्च आर्टिकल्स में यू गेट पब्लिकेशन बायस, वेयर द जर्नल्स विच आर द साइंटिफिक जर्नल्स, दे आर रिस्पॉन्सिबल फॉर डिसेमिनेशन ऑफ द रिसर्च स्टडीज, राइट. सो उनमें पब्लिकेशन बायस मिलता है. कुछ स्टूडेंट्स के क्वेश्चन आ रहे हैं. अभिनंदन मैती कहते हैं सिलेक्शन बायस इन क्रॉस सेक्शन स्टडी. येस, डेफिनेटली बेटा, इन क्रॉस सेक्शन स्टडी यू कैन गेट सिलेक्शन बायस. आप अपने क्रॉस सेक्शन स्टडी यू वांट टू फाइंड द प्रेवलेंस, एंड वहाँ पे आप सैंपल नहीं सिलेक्ट करोगे ठीक तरह, और यू माइट टेक सम क्राइटेरिया लेना. आपने स्मोकिंग का क्राइटेरिया लेना, यू टेक एवर स्मोकर एज द क्राइटेरिया, और यू टेक स्मोकिंग उस बंदे. व्हेन विल यू कॉल अ पर्सन एज स्मोकर? A person who's smoking 2 cigarettes a day, A person who's smoking 1 cigarette a day, a person who was smoking 1 cigarette a month, a person who was smoking 1 cigarette a year. किसको smoker कहोगे? 1 cigarette a year, is he equal to 20 cigarettes a day? Are you getting it? This type of bias के challenges are selection bias. Selection bias can happen anywhere. Selection bias is a classification bias. It can happen anywhere. So selection bias क्या case control में हो सकती है? बिल्कुल हो सकती है, बिल्कुल सही है. It is about what is inclusion exclusion criteria, उसको selection bias कहते हैं. In your summary table of edition 5 marrow selection bias in case control, तो होता तो है, तो मैं तो incorrect बता रहा हूँ ना. So ये this is correct. This is correct. Sir, which bias is seen in case cross CS मतलब what do you mean? Cross section study. Cross section study में we can get lot of biases. We can get incidence prevalence bias. We can get selection bias in cross section studies. Right? Publication bias के ऊपर दो चार और बातें. In publication bias you see a plot called as funnel plot. You see a plot called as funnel plot. So this is what the funnel plot would look like. If you look at this funnel plot, can you see that there is a triangle over here? In this triangle, beta, these are different types of studies you can see. These dots are denoted by the studies. So ज़रूरी नहीं है कि यही dot study है. Every dot is a study. Every dot is a study. So now this funnel will be denoted by the 95% confidence interval. Every dot is a study. So what happens in publication bias is if there are more studies on one side, अगर ज़्यादा हो जाए तो that means हमारे को ज़्यादा studies मिल रही हैं towards negative. Usually it is said that when you do a research, there should be equal amount. You should get some positive studies and you should get some negative studies. Always the balance is the rule of life. So positive जितनी होंगी उतनी almost उतनी negative होनी चाहिए. So it should always be formed like a funnel. Sometimes ये skew हो जाता है. How would a skew look like? In case of a skew, the funnel plot would look like something like this, where you will have more number of studies here and very few studies would be there somewhere. Are you getting it? This type of funnel plot means a skew. There is a publication bias. There is a publication bias. That means the journal was presenting or was publishing only certain type of research trials rather than presenting all types of research trials. This is called as publication bias. कुछ और important MCQs आ सकते हैं. Please remember, I have already discussed hospital-based case control study, differential hospital admission rates. What is this bias? Identify this bias, Bergsonian bias. This is called as Bergsonian bias. Incidence prevalence bias, beta, what is the name? It is also called as Neyman bias. Neyman bias. Loss to follow-up. Loss to follow-up means patients were enrolled for the study, but there was a loss to follow-up. This is called as attrition bias. This is called as attrition bias. And change in attitude, अभी हमने बात किया, this is Hawthorne effect. This is Hawthorne bias. And blunting of the response by a demotivated researcher, this is a prospective MCQ beta. It can come in your exam. Blunting of response by a demotivated observer or the researcher. This type of bias is called as a Golem bias. इसका opposite, the opposite of this is called as a Pygmalion bias. Pygmalion bias. Pygmalion bias is because of exaggerated response, because of motivated researcher, because of more funding, because of motivated researcher you get Pygmalion, because of ulta, because of demotivated persons you get a Golem. Remember, Golem bias is with demotivated researchers. Okay, so that was just a brief review about the different types of biases. Make sure you do them correct in your exam. Okay, a few more points about bias before I close off over here. How do you treat bias? Beta, please remember, treatment of bias is by blinding. B for bias, B for blinding. Known confounders are treated by matching, whereas unknown confounders are treated by RSSR. Unknown confounders, they are treated by RSSR. What do you mean by RSSR? R stands for randomization, standardization, stratification and regression. RSSR, these are the treatment for unknown confounders. Please remember, for known confounders it is matching. For unknown confounders it is RSSR, randomization, standardization, stratification and regression, and B for bias, B for blinding. Let's move to the next MCQ. That was enough about blinding and about biases. Let's move to the next MCQ. पढ़ो इसको, देखो इसको. This is again a prospective MCQ for your exam. This is again a prospective MCQ for your exam. So the death rates in two populations with different age groups needs to be compared. So now the problem is that the death rates needs to be compared with two different age group populations. The reference population is available, but the age specific death rates are not available. The best method to compare the death rates is direct, indirect, linear, या logistic regressions. What do you think is the best answer? So I'll be waiting for your answer in the chat box. The death rates in two populations with different age groups. What do you think needs to be compared? The reference population is available. The reference population is available, but the age specific death rates is not available. क्या बोलना चाहते हो? Direct, indirect. So absolutely correct. I think most of you have got the answers correctly. It is an indirect standardization. If you just look at this MCQ, this is a prospective MCQ. It can be asked in your exam beta. What is direct standardization? What is indirect? Standardization is when you compare two different populations. Whenever you compare, you need a reference population. So reference population if is available, and if listen very carefully, if the age specific death rates are also available, the reference population तो होगी ही, alongside if the ASDR, age specific death rates, they are also available, then we tend to do a direct standardization. Whereas if the age specific death rate, ASDR, age specific death rate is not available, in those cases you are going to do indirect standardization. MCQs, indirect standardization कैसे calculate करते हैं? You calculate something called as SMR. What is SMR? Standardized mortality ratios. What is the formula for standardized mortality ratios? Observed deaths divided by the expected deaths into 100, that is standardized mortality ratios. So I think most of you have given this correct answer. The answer over here is indirect standardization. Why do you think? What is the key word over here? It is that the age specific death rates are not available. We are going to do indirect standardization. Let's go to the next MCQ. Let's move to the next MCQ. A researcher wants to prove the relationship between COPD and smoking. बंदे कितने स्मोक करते हैं and what is the level of COPD? They want to prove it. The collected patients record from government hospital and record of the cigarette sale from finance and taxation department was taken. This is an example of what type of study? Cross-sectional study, postological study, ecological study, or operations research. What do you think is the best answer? What do you think is the best answer over here? I'm waiting for your answers. What do you think is the best answer over here? Cross-sectional. So absolutely correct. This is a perfect example of ecological study. It is a frequently asked MCQ. It is again a prospective MCQ. Third party data जब भी आप use करोगे, whenever you will use a third party data, it is called as ecological study. Next MCQ, which of the following is not a feature of systematic reviews? Which of the following is not a feature of systematic reviews? What do you think is the best answer? Which of the following is not a feature of systematic reviews? Meta-analysis is always done. Search for literature is compulsory using explicit search strategy. GIGO policy should be under consideration. Research question is always focused. What do you think is the wrong answer over here? Which of the following is not a feature of systematic reviews? So Kalpana says A. Meta-analysis is always done. Absolutely correct, beta. Which is not a feature? Meta-analysis need not to be done. Meta-analysis is just kind of a part of systematic reviews, or you can say systematic reviews is where you review all the research systematically. So whenever you take, if you do research of all the studies, a review of previously conducted studies. If I give you 20 studies on the effect of remdesivir on COVID-19, if you review all the 20 studies together, that phenomena, that concept is called as systematic reviews. Now, once you do a systematic reviews, you can move a step further to do meta-analysis. Meta-analysis may be done, may not be done. It's not always done. Meta-analysis, it is a more better type of study design. Meta-analysis is a statistical method, है ना? It is a statistical method. It is a statistical method to find out the final effect or the real effect of the study. Okay, so that is what is meta-analysis, and this is the only one which is the wrong answer. Sir, when a data at the time, snapshot of the time, not cross-sectional, could you please explain cross-sectional ecological option for the last question? Last question हमारा कौन सा था? ये वाला था. Okay, so a researcher wants to prove the relationship between COPD and smoking. He collected patient record from the government hospital. Beta, if I was to do a cross-section study over here, I would have said that I will go to the area. ध्यान से सुनना विजय. I will go to the area. I will survey the whole area. I will conduct a survey of the whole area, and पूरे area का survey करने के बाद I will find out how many people actually have COPD, and इनमें से I will find out how many people are smokers. तो ये जो रेड कलर है, लेट अस से दीज आई फाउंड आउट टू बी स्मोकर्स. ये जो ब्राउन कलर है, लेट अस से दीज आर द पीपल विद COPD. आई फाइंड आउट दैट ये जो लोग हैं ना, this category, this is the people who are smokers as well as they are COPD. But there are many smokers who don't get COPD, and there are many people with COPD who actually did not smoke. This type of study design is called as a cross section. मैंने इस MCQ में क्या किया? What did I do in this MCQ? I wanted to prove the same relation between COPD and smokers. What did I do? I did not do any of this stuff. What did I do was, I asked कि भाई मेरा एक दोस्त था, he was in tax department. I said कि कितनी cigarette sale हुआ? And I found out from the government hospitals how many people were diagnosed with COPD. So whenever you are doing a third party data resource, now with more cigarette sale, it was seen that there is more COPD. You can compare that. Whatever data you get from Delhi, you can compare that with Kanpur, you can compare that with Lucknow, you can compare that with Chennai, you can compare that with Chicago, you can compare that with Tokyo, you can compare that with Denmark, you can compare that with anything. This type of study design, it is called as ecological study. कौन सी study कहते हैं इसको? Ecological. What is the study called as? It is called as ecological. दिमाग में बिठा लो इसको. Third party data, whenever it is asked, it is ecological study. It is called as ecological study. Some students will be asking like ये posological कौन है? Posological means जहाँ पे हम mental या emotional या social cultures को लेते हैं. That is about posological. So posological study is about mental, emotional, cultural factors. When you study those, that is a posological study. Okay. So please let's move to the next MCQ. If you are doing systematic reviews, that means you do all the studies together, and then if you do the statistical analysis, that is called as meta-analysis. Let's move to the next MCQ. A researcher wants to know whether there is association. ध्यान से सुनना, ये बहुत frequently asked, ये घिसा हुआ MCQ है. This is a घिसा हुआ MCQ. It is a frequently asked MCQ. It's a very घिसा पिटा MCQ. A researcher wants to know whether there is an association of CRP values with the MI or stroke. The study group was divided into quintiles following table and is formed based on the study results. Which of the following statements is true regarding the relationship between CRP and the risk of MI or stroke? So you see this table. I don't know कितना का आपके screen में visible है, but let me just see if I can थोड़ा बड़ा कर दूँ अगर. Yeah, I think I can. So if you just look at this, table, you can see these quintiles. Quintile मतलब उसके tiles होते हैं. Okay. Quintiles मतलब उसके tiles होते हैं. So you have first part, second part, third part, fourth part, 5 parts. So there are 5 quintiles in this. These are 5 pentiles, we would say. So CRP values इसमें अलग अलग हैं. 0.1 to 1.0, 1.1 to 2.0, and then you have C reactive protein, right? 2.1 to 3, 3 to 4, 4 to 5, ऐसा करके कुछ numbers हैं. Then you are given the relative risk. That is more important from community medicine point of view. Relative risk दिया है with the CRP values. So relative risk you can see is 1, it is 1.3, 1.7, 2.1 या 2.8 ऐसा करके आ रहा है. So study population is almost similar. So what do you think it is? I think many of you have already started answering. Very nice, beta. Increase in CRP increases the risk of stroke. Why? Because you can see that ये ज़्यादा बढ़ता जा रहा है, ये ज़्यादा बढ़ता जा रहा है, तो क्या ये रिस्क बढ़ेगा कि कम होगा? What do you think? So absolutely correct. Absolutely correct. There is increase in CRP increases the risk of stroke. Option number one, why is it wrong? CRP has no association with risk with the MI. This is false answer. This is false statement. Increase in CRP decreases the risk of MI. This is also false. This is also false. In quintile 1, listen carefully, see carefully. In quintile 1, low CRP value is there, are associated with high risk of MI. यहाँ पे relative risk तो 1 है ना, relative risk of 1 means no association. So in the first quintile, there was proven that there is no association at low CRP, but if the CRP increases, then there is association. Did you understand the word? If the CRP is on low side, that means there is no association. ऐसा नहीं है कि it is protective. If the CRP is low, there is no association with MI, but if the CRP increase, the MI, the chance of having MI will increase. This is what is relative risk. Just few points about relative risk and case control and odds ratio. Odds ratio can be is also called as a cross product ratio. It is from a case control study design. Relative risk is also called as risk ratio. It is from cohort study design. Relative risk is given by the formula incidence in exposed divided by incidence in non-exposed. Odds ratio is cross product ratio, A into D over B into C. That is, if you take these cells, that is these two cells multiplied by the other two cells. These two cells multiplied with the other two cells, this is called as odds ratio AD by BC. Beta, if the odds ratio or the relative risk, in दोनों का मतलब एक ही है, if they are equal to 1, that means what? No association. If it is more than 1, it means a positive association. Less than 1 means a negative association. So make sure you get this question right in your exam. This is a frequently asked MCQ. So next MCQ, occurrence of two variables more often than would be expected by chance. I think I have a few doubts over here. Let's discuss the doubts. Garbage policy, GIGO policy. GIGO policy means garbage in, garbage out. ये क्वेश्चन पुराना था. GIGO means garbage in, garbage out. It is said that if I give you, I told you na that if you are doing 10 research trials, I think Abhinandan had asked about this GIGO point. GIGO means beta garbage in, garbage out. If you are doing a systematic reviews, please listen carefully, Abhinandan. If you are doing a systematic reviews में I will give you 10 studies. 10 studies about remdesivir and COVID, use of remdesivir in COVID. So now you are going to do a systematic reviews to find out the final effect of remdesivir for COVID. If I give you garbage studies, if I give you bekar studies, if I give you studies which are done in home-based studies or studies which are done in small hospitals in rural areas, the validity of that study is not at all good, right? So that means I'm giving you garbage studies. If you feed in garbage, what will come out? Garbage will come out. Garbage in, garbage out. I feed you bad things, you will say bad things. I feed you good things, you will say good things. Garbage in, garbage out, good thing in, good thing out. So that is what is GIGO. It is used in this system. This concept is used in systematic reviews. Let us go to the next doubt. The next doubt is PDF मिलेगा. PDF कुछ नहीं, इसको यहाँ पे देखो और इसको समझो. ये अब GIGO विगो, where will I write in PDF? कहीं नहीं लिखा हुआ ना. Is quintile different from quartile? नहीं, quintiles is basically you can say pentile को भी हम quintile कहते हैं, but yes, quartile is with 4. Quintile could be with any number, but usually with 5. So pentile की जगह we call it as quintile. Anyways, that's not very important. Ivermectin studies, yes, we can do that ivermectin studies. Let's come to this MCQ now. Occurrence of two variables more often that would be expected by chance. Is it called by as confounder? Is it correlation, bias or association? So occurrence of two variables more often that would be expected by chance. मेरी एक आंख है, मेरा एक नाक है. Is this a chance or it is more often? It is always often. This is called as association. It is not called as confounder. गलत बोला श्रीयम किशोर. It is not option B. It is not confounder. Confounder is the wrong answer. Confounder is any variable which is associated with risk factor and with disease, and it may directly or indirectly lead to disease. Directly leads to the disease. This is called as a confounder. Confounder galat answer hai. Answer is association. So having two variables together is called as association. What is correlation? So correlation means two variables together, they are associated, but with one increase the other या तो बढ़ेगा या कम हो जाए, something will happen. They will be correlated. Correlated tells you about the direction and strength of association. So correlation, if you enter a room, there is a fan, there is a light, है ना? If you enter a room, there is a fan, there is a light. Usually in any room in India, you will find a room fan and a light, है ना? If you switch on the fan will move at 5 number. But the light does not move at 5 number. They are not correlated, but they are associated. They happen together. But with one increase, the other does not increase. Are you getting it? So very simple example that I very often give in the classes is about this type of correlation. Correlation and association. Having your heart, having your eyes, they are associated, but eyes blink, heart does not mean that you blink more or heart beats more or less with the eyes. So they are not correlated, but they are associated. Is this spurious association? No, you can say it's a type of spurious association, but usually we say this as a correlation, confounder, or association. These are having two things is associated, but with one thing the other also changes. Correlation. Confounder is it could be a spurious association if it does not lead to the disease directly. Okay. Let's move to the next MCQ. Some numericals. There's in fact I think just 2-3 more questions from epidemiology, and that will be all. A research trial for new drug for leukemia is there. Listen very carefully. This is again a previously asked previous year MCQs. These are previous year MCQ for your INICET exam. Previous year MCQ for your INICET exam. In a research trial for a new drug for leukemia, there were 36 deaths or treatment failures out of the sample of 120 in the control arm with the standard drug. Whereas in the new treatment, 26 treatment failures were reported from a sample size of 130. How many patients need to be treated to avert one death? So you probably would need a calculator over here because you might be doing it for the first time. But once you are done doing it for the first time, then in the subsequent time you will not need a calculator because these are very simple calculations. Usually in your exam they will not ask you very difficult type of calculations, but right now I would suggest you to take a phone, separate phone, and use a calculator to do this. Anyways, I'll try to show you how to do this. Beta, in this MCQ, does anybody know how to solve these types of MCQs? It has been asked so many times in your exams. This is called as, absolutely correct, beta. This is called as number needed to treat. This is called as number needed to treat. So how many patients should be there to do a number needed to treat? If you watch for previous INICET recalls also, I have discussed this so many times. There is also a YouTube session which is available by Marrow, and that is about the numericals in community medicine. So just search in YouTube about numericals in community medicine by Mukhmohit. You will be finding a 1-hour lecture. I have discussed all the numericals. So what is this number needed to treat? I would recommend you to watch that also. Very quickly, for all the students who did not understand or who do not know about NNT, NNT stands for number needed to treat. So how many people you should be treating so that you are averting one death? So what happens is absolutely correct. People are giving right answers, Shriyam. It is 1 divided by ARR. That is absolute risk reduction. Wow, I'm so proud of you. You've made my callers top. And thank you so much for answering this correctly. Kalpana, number needed to treat. Very nice. Mehul says 10. Wow, tune answer hi bata diya. Olaf is 100 by ARR. So absolutely correct. Very nice, beta. I think many of you have already done this type of MCQs. So let me just straight hit on to this topic. So what is this question saying? This question is saying This question is saying that you have to make a table like this. This question is saying you have to make a table like this. So on the top, always on the top of the table, always make sure that you put the events over here, like people with cancer, no cancer, people with risk factor, people with the rare some adverse effect, yes or no. So over here I will take treatment failure. So event was there or no event was there. Okay, on one side I take event, on the other side I take no event. No event. Okay, on one side we take the experimental drug and then we take the control drug. So what is this question saying? Listen to this question. They were reported 36 deaths or treatment failures out of the sample of 120 in the control arm. So in the control arm, there was a sample of 120. So 120 will go here. Out of this, 36 people reported deaths or the event was there. And in the new treatment, 26 treatment failure were reported from a sample of 130. So 130 will go where? 130 has to go here. 130 has to go here. And then 26 people were finding deaths or treatment failures. We found that. So what you have to do is you find the event, number of people with the event positive, no event, experimental group or the control group. So what did we find out? We found out of the total 130 and 120, 26 and 36. So 26 and 36, how much? 130. 130 and you have 120. So beta, you can calculate something called as control group event rate. What do you mean by control group event rate? CER. This is given as CER. CER. Control group event rate, that is, let me just call this as A, B, C and D. So in the control group, what was the event rate? That is C over C plus D. That is 36 divided by 120. Okay, in experimental group event rate, experimental group, which is the experimental group? This one. 26 out of 130. So A over A plus B, that is 26 over 130. So I think everybody knows the table of 12. 12 threes are 36. So this will be 0.3. Everybody knows the table of 13. 13 twos are 26. So this will be 0.2. So how will you calculate the absolute risk reduction? That is CER minus the EER. Absolutely correct. 0.3 minus 0.2, that is 0.1. Okay, so how will you calculate the number needed to treat? Number needed to treat is given by the formula 1 over absolute risk reduction, that is 1 over 0.1, that is equal to 10. Very simple. Just remember, this is in your exam right now, they will not ask you anything which will require a calculator. They will only ask you very simple mathematics, or maybe sometimes they may ask you directly the formulas, because they cannot ask you the calculator based numericals now. So last is, what do you mean by relative risk reduction? You have to remember the formula. It is the CER minus EER, that is the absolute risk reduction, divided by CER. Just remember this. So remember, what do you mean by absolute risk reduction? Remember what is relative risk reduction, what is number needed to treat. This is a kind of MCQ which may be troublesome for many students, but in case you know the concept, then it is super duper easy. So what is the best answer over here? The answer over here is 10. I'm so proud of you. Thank you so much everyone for answering this correctly. Let's move to the next MCQ. Which of the following studies will show the equivalence on new drug? So sometimes whenever we do the clinical trials, sometimes you may give remdesivir. Let us say this, on one hand I have remdesivir. Let us say on the other hand I have any other antiviral drug or any other drug, right? So there are chances, listen very carefully, there are chances I may test a new drug to tell you that it is equal to this. That means this drug is lying in the zone of equivalency. Or I might do a trial to tell you that this drug, listen very carefully, this drug is superior to the standard drug. That is, I am doing a superiority trial. Or the third is most important, listen very carefully, I may do a trial where I tell you that this drug compared to the standard drug, I don't know whether it is equal or superior, but at least I can tell you this is not inferior. Are you understanding? We can do a non-inferiority trial, superiority trial or equivalency trials. कितने बोले मैंने? You can do 3 types of clinical trials. You can do a non-inferiority trial. You can do a non-inferiority trials. I can tell you that this drug, the new drug, it is not inferior to the previous drug. Or I can tell you a superiority trial, or I can do equivalency trial. Are you getting it? Three types of trials: non-inferiority trials, superiority trials, or we can do the equivalency trials. So based on this, what we do is whenever we are testing a new drug, we have to say that this is what is my zone is. So I will have zone of equivalency, that this is my equivalent zone and this is my lowest criteria and this is my top criteria. This is my top criteria. This question is a previous INICET MCQ. So if you look at the drugs, which drugs will show equivalency? Please note that the drugs which is C, D and E, these three drugs, they will show equivalency because they are in that equivalent zone. Drug F and G, they definitely are not equivalent. They are kind of superior. Drug A and B are definitely not equivalent. They are towards the the standard drug, but they may be something better. So which will show equivalency? Equivalency is shown by this C, D and E. So which of the following will be the best answer? I think many of you have answered this correctly. This is C, D and E is the best answer. That is, these drugs are these are equivalent drugs. If you look at this trial, just look at this trial. So in this, you have said that this is my lowest area, this is my lowest area, then this is my maximum area. This is my maximum point. So can you say that drug G, it shows a definite superiority? Can I say a drug A, it shows a definite inferiority? Other drugs, all other drugs, B, C, D, E, F, G, H, whatever drugs you are doing, they all are non-inferior. Out of the non-inferior, you can have some equivalent, you can have some superior, definite superior, and so on. But I hope you understand that whenever you are doing clinical trials, you can say non-inferior trials, superiority trials, or you can do is equivalent trials. So absolutely correct. What is drug A? Drug A will be inferior. F and G, these are kind of superior trials. These are superior drugs. Next is a question from biostats. Refer to the image. Refer to the image. 4 groups of homogeneous sample were taken and height and weight of each had correlation coefficient of 0.6. Total 6 different colors are there. The total correlation of the combined group will be 0.6, 0.6, less, more, equal, or what do you think? So beta, whenever we are talking about correlation is given by something called as Pearson correlation. It is given by the formula of Pearson correlation. Pearson's correlation. Beta, Pearson correlation, it can be -1 or it can be +1. It is given by the symbol R. Okay. So R can be -1 or max it can be +1. Over here they say R is 0.6. Over here they are saying that the R value is 0.6. So 0.6 means a positive correlation. It means a positive correlation. So whenever you have many correlations and you want to find the final one, you just have to take the average. Answer is 0.6 correlation coefficient. If you just look at this, this is a very old research study. So you can say that I just want to bring your notice over here to this paragraph. If I just zoom into this paragraph, can you read this? It says that the averaging methods are appropriate when several different samples are independently drawn from the same population and the interest is in aggregating these samples. So averaging methods are kind of appropriate. So very simple answer over here. You can see that the answer over here will be averaging. So how will you average it? Answer will be 0.6. Okay. Let's go to the next MCQ. A study for smoking and lung cancer finds the attributable risk. This is a frequently asked MCQ. It is again a frequently asked MCQ. A study for smoking and lung cancer finds the attributable risk percentage for smoking as 95%. All of the following are correct except. So which one do you think is the wrong answer? What do you think is the wrong answer over here? This is again a previously asked MCQ. A lot of questions come on attributable risk, population attributable risk. So what do you understand by this? I'm waiting for your answers. 95% of the lung cancer cases can be avoided if the smokers as smoking is eliminated. 95% of the lung cancer can be avoided in the general population if the smoking is eliminated. It is the fraction of the people who develop disease among the exposed population, or it is measured by the dividing risk difference by the incidence of disease in the exposed group. What do you think is the best answer? So I think many of the students have got it correct. This is again a previously asked MCQ. It has been asked so many times in your exam. Let's have a very quick review about what do you mean by attributable risk, population attributable risk, and what is the relative risk. Whenever we do a cohort study, you know that in a cohort study, we will have people with risk factors plus or without risk factors, and then we do a follow-up. After the follow-up, we find the people with disease or with no disease, that is D plus or the D minus. And in people who are without the risk factors, you will find, again, you'll do the follow-ups, and then you'll divide the people with the disease or with no disease. So whenever we are talking about this type of study design, it is called as a cohort study, right? So in a cohort study, you will always build a box like this, that is people with disease or no disease. And then you have the risk factor plus or the risk factor minus, A, B, C, D. So beta, you can calculate something called as relative risk. What do you mean by relative risk? It is called as incidence exposed divided by incidence non-exposed. That is, what is the incidence exposed? How many people get the disease out of the exposed group? That is what is incidence exposed, that is A over A plus B, divided by incidence in non-exposed, that is C over C plus D. Am I correct? This is called as risk ratio, also called as risk ratio, also called as relative risk. Relative risk. Beyond this, now your MCQ can be, we can also calculate something called as attributable risk. Beta, attributable risk is incidence exposed minus incidence non-exposed divided by incidence exposed. That is the formula. So what does attributable risk means? Listen very, very carefully. Attributable risk means that out of this whole population, let us say this was my total population. Okay, this was my total population. Out of this population, there were some people who were with the risk factors. These were the people with the risk factors, and there were some people who were without the risk factor. There is no risk factor. Okay. Now, when we talk about the disease, I found out that mostly people with the disease, people with risk factor, they got disease. But then there were some people who were, can you see this portion? Can you see this portion? There were also some people who were without the risk factor. They also got the disease. Are you getting this? So now there are people who are with the risk factors. So now what is the funda of attributable risk? Attributable risk tells that among the exposed, among the risk factors, so out of this whole population, how many people are having the disease? That funda is called as attributable risk. But what is population attributable risk? PAR. PAR tells you that out of the total population, how many people have disease. So out of the total population, how many percentage is because of the risk factor or because of the exposure or because of the risk factor? That is population attributable risk. Population attributable risk. That is what is population attributable risk. So please note that whenever MCQ, please note that whenever we talk about public health policies, in public health we will use attributable risk, population attributable, not attributable. In public health we will use the population attributable risk, whereas the attributable risk, it tells you that among the exposed, listen carefully, among the exposed, what percentage have the disease. So what is the funda of attributable risk? Listen very carefully now. 95% of the lung cancer can be avoided in smokers if the smoking is eliminated in general population. What do you think? This is attributable risk. Absolutely correct. It is 95% of the lung cancer can be avoided among the smokers. How much percent of disease can be avoided among the smokers, among the exposed, if you remove the risk factor? That is attributable risk. But look at the second option, 95% of lung cancer cases can be avoided in general population if the smoking is eliminated. Beta, this is what is population attributable risk. Population attributable risk. Population attributable risk is given by the formula incidence total minus incidence in exposed divided by incidence in the total population. Just remember this, incidence total minus incidence exposed divided by incidence total, that is population attributable risk. Next is, if the fraction of people who develop disease, it is the fraction of people who develop disease among the exposed, that is what is the technical definition. This is absolutely correct. This is true. This is the correct answer. This is the correct definition. So absolutely correct. This is also the correct answer. It is measured by dividing the risk difference, that is incidence. What is risk difference? That is incidence exposed minus incidence non-exposed divided by the incidence in the exposed divided by incidence exposed. This is also true option. So all three are true option. Which is the only one which is wrong? You had to find out the wrong one. The wrong one is this option. It is 95% of the lung cancer cases can be avoided in the general population. The smoking is eliminated. That is population attributable risk. So please note, you have to understand. I'll repeat again, just a quick summary. Just a very quick summary, I would say. Listen very carefully. Summary of the game is, what do you mean by attributable risk? Population attributable risk. Out of the total, listen carefully, out of the total risk factor patients or risk factor or the exposed group, if you remove the smokers, if you remove smoking as a problem, so in smoker population who were old time, purane time mein, who were smokers, now they don't smoke. Among those population, how much disease will be decreased is given by attributable risk. समझ में आया? People who are working in some dye industry, वो तो पहले they were exposed ना, now they stopped going there. If you remove the exposure, how much percent of disease will be decreased? That is attributable risk. So it is percentage of disease decreased in exposed population, that is attributable risk. It is percentage, population attributable risk is percentage of disease decreased in total population. Of course, by removing the risk factor in question. That is the funda understanding about attributable risk and population attributable risk. This is a 5-star MCQ topic for you. So if it is clear to you, just send a thumbs up. Otherwise, I'll need to repeat it again. Please note that attributable risk is how much disease can be eliminated from the exposed group. Population attributable risk is how much disease can be eliminated from the total population. That is what is the best answer. So which of the following is the wrong one? The wrong one is option number B. That is the incorrect answer over here. Okay, so now let us move to another MCQ. A related MCQ, very frequently asked over here. A related MCQ, a very frequently asked over here. A researcher conducts a case control study to evaluate the risk factors for low birth weight in 200 females attending ANC clinics and admitted under labor room in Department of Gynecology. The outcome was 100 females with low birth weight, another 100 females with normal birth weight. The females were then questioned based on the factors influencing, and this was the result. So they had found out how many females were having low birth weight, and they had found out like what is the risk factors in them. Find the risk factors which show a significant association. So what do you think? Which factors will show a significant association? So let me just delete this and let me just make this bigger for you guys so that you can see it easily in your screens. Okay, so which factors do you think are the significant risk factors? Low fat intake, odds ratio 0.4. Can you comment on this? What is this risk factor? This is low fat intake showed a protective factor. It showed a protection. Low carbohydrate intake, that is a risk factor. It showed as a risk factor. High protein intake, it was again a protective factor. Alcohol, it is a risk factor. It showed a risk factor. Number of hours of TV watching, it is a risk factor. Stress level is a risk factor. Smoking is again a risk factor. The other ones are protective factor. Okay. So let us just write this also in a different color, protective factor. Done. This is how you find out. So you find out which are the risk factors. These are the risk factors. So now when to say which one is a significant risk factor? Whenever we are talking of significant risk factor, I think everybody is answering very nice. Alcohol, stress, Vijay, Ananya, Mansi, Shriyam, Vinay, very nice beta, very nice. So when to say a significant risk factor, you just have to look at the 95 confidence interval. If the value 1 is within the confidence interval, that means it is a non-significant. If the 1 is away from the confidence interval, that means it is significant. So in simple words, if it is decimals and like less than 1 and more than 1 together in the confidence interval, that means in that particular entity there is a non-significant risk factor. So low carbohydrate, can you say it is a non-significant risk factor? Then alcohol, it is a significant risk factor. Number of hours of TV watching, it is a non-significant risk factor. Stress level, it is a significant risk factor, and smoking is again a significant. So which one are significant? You find 3 things: alcohol, stress levels, and smoking. Absolutely correct is the stress, alcohol, and smoking. These are the important significant risk factors. So that's how you just have to see the value of 1. You just have to find the value of 1. So which are the risk factors? You find alcohol, stress, and smoking as the best answer over here. Okay, let's move to another type of MCQ. This is from recent updates. You can say that not recent updates, over few decades we have moved from general epidemiology to genetic epidemiology. This question is again from the question of genetic epidemiology. So adapting environment to the genes to improve health is called as, what do you think? Adapting environment to the genes to improve health is called as, what do you think? Eugenics, euthenics, euphenics, या acculturation? Acculturation, I think everybody knows about acculturation. It means culture contact. And of course, this is not the correct answer over here. So adapting environment to the genes to improve health is called as, listen very carefully. What do you mean by eugenics? Beta, eugenics mean is what Hitler had done. They wanted to improve the genetics of human race. How do you improve? Listen very carefully. आप सबका आंसर 100% का आंसर गलत है. Everybody is answering wrong over here. Hitler wanted to improve the genetics genes of the human race. How did they want to improve the genes of the human race? वो कहते हैं कि भाई ये बंदा उसके साथ ही बॉयफ्रेंड गर्लफ्रेंड बनेगा. Selective mating, you can say. That there was a selective mating. High intellect persons, they were allowed to mate or marry और उनके साथ sexual intercourse होगा only with the high intellectual females, so that the genes are more improved. That is what was the understanding old times में. This is called as eugenics. It is to improve the human race. We do genetic understanding. But what do you mean by euthenics? Of course, this eugenics, it has a problem of ethics. It has ethical issues. You can't do that, right? प्यार भी तो कोई चीज होता है. You can't do that. So there are ethical issues. What do you mean by euthenics? Euthenics is ethically allowed. It is ethically allowed or ethically modified genetic education. Modified genetic education where you take the environment to improve the genes. जैसे कि you make better people so that they become or their children will become better people. Are you understanding? सो इफ आई गिव न्यूट्रिशन गुड, सबको बादाम देंगे, सबको अखरोट देंगे, सबको पढ़ाएंगे लिखाएंगे, वी टीच एवरीवन, वी मेक श्योर दैट एवरीवन हैज अ डिसेंट स्टैंडर्ड ऑफ लिविंग, वी गिव देम गुड फूड, वी गिव देम गुड एजुकेशन, देयर जेनेटिक मेकअप विल बिकम बेटर एंड दे विल बिकम बेटर ह्यूमंस. इनके जो आगे बच्चे होंगे वो बेटर होंगे. डॉक्टर के बच्चे बेटर डॉक्टर्स. आर यू गेटिंग दिस? दैट इज व्हाट इज यूथेनिक्स. Euthenics means adapting the environment to improve the health by using the genetic knowledge. Euphenics क्या चीज है? What is euphenics? Euphenic is phenotype. Phenic मतलब face है ना, face, phenotype. So बच्चा पैदा हो गया with some genetic abnormality, you give them prosthesis. उसका हार्ट डिफेक्ट था, पेटेंट डक्टस आर्टेरियोसिस था, उसको कोई implant लगा दो, you give them some treatment to do modification of the genetic abnormality, उसको कहते हैं euphenics. Example के लिए just look at this euphenics. Look at the screen. This is a 5-star MCQ for you. Look at the screen. Euphenics, face. It is the science of making phenotypic improvements to humans after birth. Examples of euphenics can be in avoiding ingestion of phenylalanine if a person has phenylketonuria, insulin injections to children who are born with type 1 diabetes, prosthetic limbs to genetic conditions with missing limbs, pacemakers for cardiac defects, implants for any sensory defects. This type is called as euphenic. This is euphenic. Phenic matlab phenotypic. Euthenic क्या होता है? Euthenic is improvement of the human race by improving the environmental conditions, subjecting to better nutrition, unpolluted ecological conditions, better education. उनको पढ़ाओ लिखाओ, medical facility, you make better humans to make better humans. Eugenics is selective matings to improve human race. That is eugenics. So just a very quick, I think most of you had this problem in understanding what is the broad difference between euthenics and eugenics. Eugenics is, ये table मैंने खुद बनाया. It is a 5-star MCQ table for you. हो सकता है ये एग्जाम में आ जाए. Please make sure इसका screenshot ले लो and इसको याद रखना है. Eugenics क्या होता है? It is selective genetic inheritance with genetic laws. It is for future generations. But euthenics क्या होता है? It is more ethically modified. It is more ethically adapted. यहाँ पे environment को हम change करेंगे by giving them best environment in terms of mental health, emotional health, social health, everything, to work on the present generation so that you can have future better generations. It is to develop better humans now to have a better race in the future. So there are problems, ethical problems and moral problems in eugenics. तो लगा ना धीरे का झटका जोर से? हो गया ना गलत आपका आंसर? So please make sure that you do your answers correctly. What is the best answer over here? बोलो अब क्या मार्क करोगे एग्जाम के लिए? What are you going to mark? We are going to mark euthenics as the best answer over here. One of the student wanted to have another question on probably upon significant trials कब कहते हैं. See this MCQ. There's again INICET pattern MCQ. A clinical case control study was conducted to assess the relationship between interception and a new vaccine for diarrhea. ध्यान से सुनना, बहुत easy MCQ है. Just listen to it, read it very carefully. The odds ratio was found to be 2.1. 2.1, what does it mean? It means a positive association. It means a positive association. That means it is a risk factor. So it was found to be 1.6 to 2.9. That is a significant risk factor. P-value is 0.01. That means again it is a significant risk factor. Now the question says that the risk of interception was concluded to be 2 times higher in the vaccine recipients. The study assumed that, this is the whole game, the study assumed that odds ratio is a good approximation of the relative risk. In what situations, which of the following best supports this assumption? When will you say कि odds ratio is equal to relative risk? ऐसा कब कहेंगे आप? In what situation will you say odds ratio is equal to relative risk? When will you say this? Odds ratio equal to relative risk. Please remember there's a direct MCQ. You will say that odds ratio is equal to the relative risk whenever the disease prevalence is low, या फिर हम कह सकते हैं disease is rare. If there is a rare disease, then the relative risk will be equal to the odds ratio. So the confidence interval for odds ratio is narrow, that is wrong answer. The exposure is associated with preventive, wrong answer. Incidence of interception is low, this is the correct answer. That is what we were looking for. The odds ratio is statistically significant, this is also wrong answer. Which is the best answer? Whenever the disease will be rare, you will have a kind of difficult, or when the disease is rare, the odds ratio will be becoming equal to the relative risk. So therefore we say that rare diseases which is the best study we do is case control study, because odds ratio will be equal to, it is an approximation of the relative risk. Okay, so now let us move to the next inline chapters about next topic, that is screening of disease. Okay, करो इसको, ट्राई करो आंसर करने का. If a test has 98% sensitivity and the results comes out to be negative, what does this mean? What does this mean? If a test has 98% sensitivity and the result comes out to be negative, what does this mean? Needs further evaluation with the test of similar spectrum. Results should be discarded due to high false negativity. Disease has 2% prevalence in the population. The disease can be safely ruled out. So what do you think? A test has decently high sensitivity, 98% sensitivity, और टेस्ट का रिजल्ट जो है वो नेगेटिव आ गया. So what do you think you are going to do? What do you think about this? Needs further evaluation with the test of similar spectrum. The result should be discarded due to false negativity. The disease has 2% prevalence in population, or the disease can be safely ruled out. क्या बोलना चाहते हो? Please note that this question is talking about 98% high sensitivity. Whenever the sensitive, if a sensitive test is negative, that means it is safe to rule out the disease. It is safe to rule out the disease. Answer is option number D. The disease can be safely ruled out. Beta, if a highly sensitive test comes out to be negative, please remember disease can be ruled out. इसके लिए मैं आपको छोटा सा ट्रिक देता हूँ. Remember spin snout. Remember spin snout. That means what? Specificity is for ruling in the disease, is for ruling in the disease. Specificity is to rule in the disease. Spin, S-P-I-N, specificity for ruling in the disease. But what is sensitivity? It is for ruling out the disease. Sensitivity is to rule out the disease. इसको याद रखना. Specificity is to rule in, sensitivity to rule out. Spin snout. So whenever you have highly specific test, अगर वो test negative आ गया, positive आ गया, that means you are going to rule in. In case of highly sensitive test, if the test comes out to be negative, then you rule out. So negative, sensitive and positive specific tests are very important for us in public health. So negative test which is highly sensitive, it is almost negative. A specific test, if it comes as positive, it is almost positive. Are you getting it? So that's what this question wanted to say. Let's move to the next MCQ. Which of the following statement is true? PPV increases with increasing prevalence. Sensitivity depends on the prevalence. Specificity depends on the prevalence. In low prevalence, positive of highly sensitive test means true positive. So what do you think? Which of the following statement is true? What do you think? Which of the following statement is true? PPV increases with increasing prevalence. You remember, this is the table for screening of disease. You already know that there is disease negative, people are tested positive or people are tested negative. So you already know that about the prevalence. When you talk about the prevalence means the total D plus. यही हुआ ना? People with disease, this is what is prevalence. So TP over TP plus FP What is this called as? Positive predictive value. So that means as the prevalence will increase, the predictive values will, positive predictive value will increase. So please remember, PPV, positive predictive value, increases with increasing prevalence. This is true. Positive predictive value increases with increasing prevalence. This is true. Sensitivity depends on prevalence. This is false. This is false. Sensitivity is not dependent on prevalence. Specificity is not dependent on prevalence. They both are false option. In low prevalence, that means ये disease ऐसा सा दिखेगा. The table will look like this. The prevalence is low ना. Positive of highly sensitive test means too positive. Again, this is false. Why? Because high sensitivity has nothing to do with the prevalence again. You already note that B, C, D, they are false option. Which is the correct answer over here? PPV increases with prevalence. Absolutely correct. Everybody has given the correct answer. Everybody has given the correct answer. Okay. So Instagram story question, absolutely correct. Spin and snout. Sensitivity is to rule in, and specificity is for ruling in, sensitivity to rule out. So ये भी एक frequently asked MCQ है. This is also a frequently asked MCQ. The following may lead to widening of the confidence interval except. All of the following may lead to widening of the confidence interval except. What do you think is the best answer? Increase in population sample size, decrease in population sample size, increase in variability, increase in confidence limits. What do you think will lead to widening of the confidence interval except? What do you think will lead to widening of the confidence interval? Beta, if there is increase in sample size बढ़ गया, what will happen to the confidence limits? Increase in sample size will decrease the confidence limit. So there is decrease. This is the correct answer. Decrease in population sample size will lead to widening. Okay. This is the correct answer. This is true answer. I have discussed this so many times in your marrow lectures. Increase in variability, increase in confidence interval. This is again false. Like increase in variability, yes, definitely. Increase in variability will also increase the confidence limits. Increase in confidence limit to hai will widen the confidence limit. So this is also true. This is also true. So all are true options. Okay. So which is the false one? You had to find the false one. You had to find the wrong one. So wrong option is option number A. There is decrease in population sample size. There is decrease in population sample size. Okay. Let's move to the next MCQ. In a study to evaluate the biomarker levels for endometrial cancer, the following graph is obtained. During preliminary research, the cutoff criteria was set at point A. Later, the guidelines wanted to consider moving the point A to point B. What will be the effect on specificity as per your understanding? Specificity batana. So what do you think is the right answer? What do you think is the right answer? Specificity. What do you think is the correct answer over here regarding specificity? Beta, you already know that these are the healthy population. This blue color is the healthy population. Okay. This blue color is the healthy population. Let me just take this and duplicate it and delete this. Okay. Let's just focus on this thing. Okay. So if you talk about this healthy population, you already know that this is the healthy population. You already know this is the healthy population. So in this population, if you forget about this line B, just look at the focus on the line A. If you take line A as the main cutoff, if you cut off at this point, there were some people who were actually healthy, but they will be diagnosed as disease because as the tumor markers increase, they will be taken as disease. So what will happen? This is what false positive or false negative. These are falsely positive. They are falsely positive. Okay. Now if you move from point A towards point B, what will happen in these cases about the false positives. What will happen to the false positive? The false positive will be low. So in point B, the false positive will be low. Are you getting it? If the false positive is low, that means the specificity will be high. You remember that false positive is inverse of specificity, or specificity is inverse of false positive. Sensitivity is inverse of false negative. I hope you remember this from your general understanding. So you already note that what is going to happen to the specificity. Absolutely correct to all the students who have answered this nicely in your chat box. Very nice. Few students only could answer this, but the specificity will tend to increase if you move from A to B. The false positive is going to decrease, because initially at point A you had more false positive, at point B you have lesser amount of false positive. I hope you get this, and let's move to the next topic or the next chapter about understanding about medical statistics. Okay. Let us talk a little bit about very brief questions about sampling. Sampling is something which is very frequently sample size. Sample size or sampling is something which is very frequently asked in your exam. A village was divided into 5 groups for survey. The sample was drawn by selecting people randomly from these groups. What type of sampling was done? So a village was divided into 5 subgroups. Then from each subgroup, samples were taken randomly. So what type of sampling is this? Is this random sampling, simple random? Is this stratified? Is this cluster? Or is this systematic random sampling? What do you think is the best answer? So what do you think is the best answer? Yeah. Does it look like simple random sampling? Does it look like stratified random, cluster sampling, or systematic random sampling? What do you think? Absolutely correct. John Wick, Mansi, Sharon, everybody answering correctly. It is stratified. Why? Because you stratified into different populations. A very quick review about your sampling methods. This is a frequently asked question about sampling methods. So sampling can be non-random sampling, or we can have random samplings. Non-random samplings is convenient, purposive, quota, or snowball. Random sampling could be simple random, stratified, systematic, or cluster. Very frequently they'll ask you about cluster. Cluster is for large homogeneous population. It is used for cluster sampling is for large homogeneous population. This is very important for your exam, so please mark a 5-star over here. Cluster sampling. It is for large homogeneous population. It is used for evaluation of the health programs. Systematic sampling, that is where the nth individual is selected. Stratified is where a sampling frame is divided based on another variable. Simple random is just random numbers. So please remember, stratified has been asked in your exam. Cluster has been frequently asked in your exam. These are the only two which are very frequently asked in your exam. So absolutely correct. The answer over here is stratified sampling. The answer over here is stratified random sampling. Okay. Let's move to some of the MCQs which many of you guys were actually waiting for. A large cohort study was done to establish a last few points from biostats, because this is very frequently asked numerical type of questions. A large cohort study was done to establish the reference range for GDM at 95% confidence limits. The median 2-hour was obtained, found to be 120 plus minus 10. How much population may have fasting blood glucose more than the upper reference range? I'm telling you a hint. Hint over here is that the upper reference range is 140 mg/dl. It is 140 mg/dl. Hint is it is 140 mg/dl. So what do you think is the best answer over here? Bolo iska. What do you think is the best answer over here? This is a very simple MCQ. I don't think you need to apply too much brain over here. So this question is asking you, upper reference range is 140. How much population, how many people is going to have more than 140 mg/dl? What do you think? The best answer, I think everybody knows about the normal distribution curve, beta. This is what is a normal distribution curve. You know this normal distribution curve. In the center point you have is the mean. In the center you have is the mean, which is the median, which is the mode. So here the standard deviation is equal to 0. Then you have plus 1, plus 2, and then you have plus 3, minus 1, minus 2, and you have minus 3 standard deviations, right? So you already know that as per this MCQ, the plus minus 120 plus minus is how much? 10. Standard deviation is given as 10. So what should I write here in the center? In the center, what should I be writing here? This should be 120. And then on the right hand side, how much should it be? 130. Because why? Because the standard deviation is equal to 10. And you already know that the standard deviation is equal to 10. So 120, 130, then you have 140, then you have 150. On the back hand side, what are you going to get, beta? 110, then you have 100, then you have 90. Am I correct? Right? So now if you understand this, can you tell me how many people are going to have more than 140? You already know that how many people are between plus minus 1 SD, beta bolo, likho isko. How many people are between plus minus 1 SD? It is 68%. Between plus minus 2 SD, it is 95%, and between plus minus 3 SD, we have as 99%. This is a 7-star MCQ. Every year you are going to get this question in your INICET exam. This is like every year. So please note, between plus minus 1 SD, it is 68%. Between plus minus 1 SD 68%. Between plus minus 2 SD it is 95. Between plus minus 3 SD it is 99%. So isko zehen mein dal lo. Please book this in your mind. It is a 7-star MCQ. So you already know that between this is 95. So how many are remaining? 5%. 2.5 will be this side and 2.5 will be this side, right? Total is how much? Total is 100. Out of this, 95 is gone. 95% will be between this. So out of 100, 95 gone. How many remaining? Total 5%. Half will be this side and half will be this side. Half is on this side, half is on this side, 2.5 and 2.5. So beyond 140, how many people are going to get? That is what the question was. Answer is absolutely correct, given by almost everybody. That is 2.5. Let's move to another MCQ, which is a similar MCQ, which was asked just very recently on the Telegram group. Just before I was about to start this session, I got this question. So immediately I went to my PPT, I changed it, I put another MCQ. So there was one more MCQ which was added to your lecture today. Distribution of IOP in 100 glaucoma patients from normal distribution curve, and mean was 30 plus minus 1 mmHg. So what is the answer? 30 plus minus 1 mmHg. 97.5% of the people will have value more than what? So what do you think you want to answer? Total was 100 glaucoma patients. So what do you think is the best answer? What do you think is the best answer? What do you think is the best answer over here? How many patients will have, like 97.5% patients will have value more than what? Answer is B, that is 26. Very nice. You already know this is the normal distribution curve. So your data shows you that there is 30 plus minus 1. This is 30, 31, 32, 33, backside 29, 28, 27. So they asked you like 97.5%, 97.5%. That means this cutoff. Why? Because you remember below this was 2.5%. So obviously more than this is how much? 97.5. So that is what is the best answer. 28 is the best answer, not 26, sorry. Not 26, it is 28 is the best answer. Not 26, 28 is the best answer. Okay, not 26, it is 28 is the best answer over here. That 28, why? Because 30 hai na, so 30 plus minus 1 hai, so 29, 28. So how many are going to have more than this? 97.5% will have more than 28, not 26 beta. So don't get confused, it is 28. Okay, don't get confused, it is 28. Let us move to another MCQ. Very important MCQ. Which of the following is not correct for the following image? What do you think about this? Which of the following is not correct for the following image? Positive skew, negative skew, mean less than median, mode less than mean less than mode. You have to find the wrong one. Okay, I'll show you the screen right now. I'll show you the image. Look at the image. So they're asking you which of the following is not correct about this graph, about this SARS Beijing Lau 2010. So about this curve, whether this curve is, what do you think? Positive skew, negative, mean less than median, mean less than mode, which is the not correct? You have to find the wrong one. So I know many of you will be answering it wrong. So what do you think is the wrong one? Hey bhaiya, mere image is there na, I'm showing you the image. So Mila. Okay, I saw your messages late, sorry. Okay. What do you think is the wrong one? You have to identify the incorrect answer. Incorrect kaun sa hai? What do you think? What type of skew? Is it a positive skew, a negative skew, mean less than median, mean less than mode? Everybody is saying option B is the incorrect one, and that is a negative skew. Please note that whenever we talk about skews could be like this, skews could be like this. So this is called as a negative skew or a left skew, and the above one, this is called as a positive skew or also called as a right skew. Okay. So whenever we get a positive skew or a negative skew, always look at the tail. Remember to look at the tail. So whenever you are drawing a box and whisker, if you get a box and whisker like this, can you see the box and whisker? Can you see this box and whisker? If I make a box and whisker which is similar to this, it is something like this. This is what is the box and whisker for that particular thing. So what type of data is this? This type of data is something like this. What type of skew are you seeing? You are seeing a positive skew or a right skew. So in a positive skew, please remember the mean, median and the mode. The mean and the median and the mode, they all will look towards the right. So mean, median, mode is there in a right skew or a positive skew. So what type of skew is this? This type is a positive skew. It is a positive skew. So it is not a negative skew. Mean is less than median, mean is less than mode. These are also wrong answers, beta. Mean is more than median, which is more than mode. So which is the wrong answer? All are wrong. All are incorrect except one, A. So I think this question was wrong. Which of the following is not correct नहीं होना चाहिए, which of the following is correct होना चाहिए, है ना? Because it is a positive skew ना, it is a positive skew. So please note that this image, it is a positive skew. So therefore in a positive skew, which one is the highest? In a positive skew, the mean is the highest. In a negative skew, I hope you remember, in a negative skew, you remember mean is less than median, which is less than mode. So वो तो negative skew के लिए था ना, but this one is a positive skew. So I think you should be getting this question right. Another type of very frequently asked MCQ in biostats is something like this. Look at the question. Look at the question. The diastolic BP of 125 females was recorded. The mean was found to be 70 mmHg with SD of 10. What is the 5th percentile value? अब ये कहाँ से निकालोगे? How will you find this? So this is a very frequently asked question in your biostats, in your INICET, very frequently asked MCQ. The mean was found to be 70 plus minus 10. What is the 5th percentile? It's based on the same understanding. You already know from your data that the BP of 125 females was recorded and the BP showed out to be 70 plus minus 10. If I draw this on a normal distribution curve, it will look something like this, normal distribution curve. So you know that the BP was how much? 70 plus minus 10. 70 plus minus 10. So what should I write here in the center? Answer is 70. Then is 80, then is 90, and then is 100. On the left hand side, on the back hand side, you have is 60, and then is 50, and then is 40. Okay. So they ask you what is the 5th percentile. So beta, please try to understand. They have asked you about the percentile. Okay. So percentile. Listen very carefully. That is what the whole confusion is. It is about the 5th percentile. It is not the 5%. It is not 5%. It is 5th percentile. What happens is that you already know that how much is between plus minus 1, you already know it is 68. How much is between plus minus 2, you already know it is 95%. And how much is between plus minus 3, you already know it is 99%. You already know this data. Now the question is asking about fifth percentile. Where is the fifth percentile? You already know that below this is 2.5%. So where is the fifth percent or percentile? Where is that person standing? This one, like total is how much? Total is 100. So 68 is between this. How much is left out? 32. 100 minus 68, that is 32. 32. So 32 ka half, that is 16% and 16%. If I ask you this percent point, so 100 में से 16 निकाल दो. In 100, you subtract 16. So at this junction, how much percentile you have? This person is at 16th percentile, or you would say that 84% are more than this. Are you getting this? This is the answer. So below 50, below at this point, how many people will be there? 2.5. More than this, how many people? 97.5. Below this, how many people will be there? Below this, 16. More than this, how much? 84%. So now this question is asking about fifth percentile. That means find एक ऐसा point ढूंढो below which it will be 5 and more than this it will be 95. So that percent will lie somewhere here. Are you able to get it? So it has to lie between 50 and 60. That is the only understanding you have to do. So when we ask you this question, you don't have to draw this much. You have to see, okay, you asking me fifth percentile, that means it is more than 2.5 percentile. But it is less than 16 percentile. So that means this value has to lie between minus 1 and between minus 2 SD. Are you able to follow this? It has to be more close towards 50. Yes, you are correct. But it will not be 50. It has to be 53. Many students will answer this, which is the wrong answer. 50 गलत हो जाएगा बेटा, 43 गलत है, 40 गलत है. Are you able to get hold of it? How to solve these types of MCQs? These are just visual MCQs, and that is what is the difference between you students who have studied from my classes and between students who have not studied anywhere or with the other faculties. The understanding is what is going to make the difference. Are you able to? I'm not talking about comparing about different teachers. I'm trying to tell you that many times students just read the books and they say that, sir, in biostats, I got a message 2-3 days before that, sir, I studied full biostats from your notes. I could not see the recorded videos. I could not attend your class anytime. I did not attend anybody's class. So I got 91,000 rank in NEET exam. मेरा क्यों नहीं clear हुआ? अब यार मैं क्या करूँ उसमें? Are you getting it? Biostats is all about understanding. I hope you can understand this. This fifth percentile, I cannot make you remember. If you want to remember, this has been already shared with you. Many students already know this. This is directly from the Marrow notes. It is from the Marrow pearls that you can remember first 2.5, fifth percentile. सारा रट लो या तो बैठ के. But nobody will study this. If you just understand the whole game, then you are able to solve it. So what is the fifth percentile, beta? What is the fifth percentile? Fifth percentile means you have to think it is more than 2.5 but less than 1 SD. So ये number कुछ होगा around that point. So वो around that point आपको mark करना है. Answer is 53.6. कर लोगे ये? Please give me a thumbs up if you have understood this. Please give me a thumbs up if you have understood this so that I can move towards the next question. So that I can move towards the next MCQ. What do you think about this? I was searching for this MCQ. Okay. Again, this type of MCQ is a 5-star MCQ. Take a screenshot of this question. इस question को इस समझ लोगे तो आपकी आधी जिंदगी पार है INICET के लिए. लार्ज, ये ऐसे ऐसे हाथ क्या दिखा रहे हो? ये क्या सिस्टम होता है? This is a new emoji I am seeing. हाथ क्या होता है कि समझ में आया या नहीं समझ में आया, या पिटाई कर रहे हैं मेरी? मतलब पुराने व्हेन आई वाज स्टूडेंट तब तो हम ऐसे वाला इमोजी भेजते थे कि सर समझ आ गया। अब या तो स्टूडेंट्स ऐसा भेज रहे हैं, एक हाथ भी दिखा रहे हैं। यार ये क्या सिस्टम है? ये हाथ वाला है। देयर आर सम रेड कलर इमोजीज। ओके, आई वाज जस्ट जोकिंग, आई वाज जस्ट जोकिंग। सो ये हाथ वाला पता नहीं अच्छा नहीं लगा, ये ऐसे करके आशीर्वाद दे रहा है मेरे को। है बहुत बड़े हो गए सब लोग। थैंक यू आपके आशीर्वाद के लिए, बहुत बहुत धन्यवाद आपका। मैं बहुत बहुत आभारी हूँ। आपका आशीर्वाद मिला, आपका हाथ मिला। आपका हाथ मेरे पे बनाए रखना। नेक्स्ट क्वेश्चन पढ़ो और इसका आंसर दो बेटा। लार्ज, आई वॉज जस्ट जोकिंग बेटा, आई वॉज जस्ट जोकिंग। इतनी रात हो गई है अब, आधे लोग तो वैसे ही और वो बायोस्टैट्स में फंसे हुए हैं बेचारे। Students are all troubled with this. Let's look at this. Just 3-4 more MCQs, nothing much. A large multi-centric, ये but ये बड़े भयंकर MCQs हैं. So please sit with your back straight. जो भी आप नशा पत्ता करना चाहते हो साथ साथ नशा पत्ता करो, बट मेक श्योर दैट यू आर अटेंटिव टूवर्ड्स दीज MCQs. ये MCQs आपका रैंक चेंज करेंगे बेटा. These are the MCQs which are going to change your ranks. A large multicentric trial showed that a non-significant effect of the aminoglycosides for leprosy cases was there. So a large trial showed non-significant effect. There was no significant effect. The present RCT conducted on a regional sample, छोटे sample पे, was done to evaluate the effect of streptomycin in 100 leprosy cases, which showed a p-value of 0.002. 0.002 beta p-value if it is more than 0.05, इसका क्या मतलब होता है? What do you mean by p-value more than 0.05? I would just like to reiterate, stop at this point and talk to you that p-value जो है बेटा वो या तो less than 0.05 होगा या more than 0.05. If it is less than 0.05, that means it is called as a significant p-value. If it is more than 0.05, it is called as non-significant value. If it is more than 0.05, it is non-significant p-value, and this p-value, it means that no effect is observed, no effect was found, and therefore what will you do to your null hypothesis? The null hypothesis is accepted or rejected if it is no effect is found. तो मतलब null भी तो यही कह रहा है ना, there is no effect. Null hypothesis is accepted. Null hypothesis is accepted. Whereas on the other hand, if you talk about the significant p-values, that is a p-value less than 0.05, that means what? There is effect is found, effect is observed, and the null hypothesis. What will you do to the null hypothesis? Null hypothesis is accepted or rejected? Null hypothesis is rejected. Very nice, mere bachcho, shabash. It is null hypothesis is rejected. So if the p-value is less than 0.05, that means null hypothesis is rejected. Based on this, we might have some errors. Based on this, we might have some errors. How many types of errors do we know? We call that the null hypothesis. N0H में लिख रहा हूँ इसको. I call it as null hypothesis. If the null hypothesis in reality, असल में reality में या तो null hypothesis true हो सकती है या फिर it could be false. What you do in your study or in your research, you might, true होगी ना hypothesis, you might accept it or you might reject it. And similarly, false hypothesis, you might accept it or you might reject it. That is what is going to happen. So if you reject, ध्यान से सुनना, if you reject a true hypothesis, ideally true थी hypothesis, null hypothesis was true, you should be accepting it. But in case you reject a true hypothesis, this is called as type 1 errors. These are called as alpha errors. The first alphabet is the Greek alphabet is the alpha. So type 1 errors or the alpha errors. On the other hand, if you by chance accept a false hypothesis, if you accept, ideally it was false, it should have been rejected. If you accept a false hypothesis, that is called as type 2 errors, also called as beta errors. Okay, so very nice mere beta, very nice. You have done it all. Classic bingo. फोड़ डाला आपने, शाबाश. Very nice. I'm so proud of you when you answer the levels of types of errors. So very nice, absolutely correct. Coming back to the story. So how to interpret this MCQ? The present RCT conducted on a regional sample showed that the p-value is 0.002. If the p-value is 0.002, that means आपने क्या बोला, आपकी रिसर्च ने क्या बोला, आपकी रिसर्च ने बोला. What did your research say? Your research said that the p-value is 0.0. It means it is a significant p-value. That means what did you do? Null hypothesis was rejected. Okay, so a large multicentric trial shows a non-significant effect. Non-significant matlab in reality, the null hypothesis was true. Why did I say true? Because there was no effect. So the null hypothesis was true but was rejected. आपने reject किया. The null hypothesis was actually true. What type of error? I told you if it was true, it is called as type 1 error. So answer is बिल्कुल सही answer, type 1 error. Absolutely correct. All the students had marked this question correctly in your chat box at least. तो बिल्कुल सही आपने mark किया. It is type 1 error, high alpha error. Very nice beta. It is type 1 error or the high alpha error. Okay. A few 3 numericals which are almost similar but sometimes very frequently asked in your exam. हो सकता है इसमें आपको calculator, you might need a calculator. So let's talk about these questions. An urban health facility which targets a population of 10,000. I'm going to discuss 3 numericals. You might need a calculator over here. But usually in your exam, they will give you super duper easy calculations. Anyways, an urban health facility targets the population of 10,000 with a crude birth rate of 20 per 1,000 population. Assuming the visit to the health center in the month of December, how many ANC females are expected to visit the sub-center in the same month? What do you think is the best answer? What do you think is the best answer? In 1 month, how many females will be visiting the sub-center? What is the highest number? What do you think is the best answer over here? I know many of you will be answering this question. Answer is 220. काफ़ी students are saying 220 वोल्ट का झटका लगेगा. 220 वोल्ट का झटका. So you think this is 220 volts? Okay, C. Many students saying C. John Wick, Dark Knight, Abhinandan, Vinay. संदीप कहता है कि 220 वोल्ट नहीं 110 वोल्ट का झटका लगेगा. छोटा है. That's okay. मानसी से बीच का नंबर ले लो, 200 ले लो. So 200 220. Anybody for 20? 20 कोई बोलेगा? नहीं? Everybody going with 110 only. Okay, let's move on. Okay, let's just not waste time. Your time is very crucial. Exam is on the head. देखो इसको बेटा, क्वेश्चन को ना ध्यान से पढ़ना होता है. ये questions are going to make or break your ranks. It is very easy to get distracted by the MCQ. Look at the screen. So the question says that the urban health facility targets a population of 10,000. So how much is the population? The population they have given is 10,000. Crude birth rate is 20 per 1,000 population. And they want to ask you how many females, ANC females will be there expected to visit the center. So if you talk about how many pregnant females, beta, you already know that how to calculate the live births. Live birth is given by the formula crude birth rate divided by 1,000 into population. So that means it is 20 divided by 1,000 into 10,000. यही था ना answer. So answer is 200. So how many live births will be there in the area? 200. So now the live births in the area is 200. You are going to calculate how many ANC females are going to visit. To calculate the ANC females, you should find out how many pregnant females are there. How to find out the total number of pregnant females, that is given by the live births plus a pregnancy wastage factor, है ना? You already know this pregnancy wastage factor, that is 200 plus 10% of 200, that is equal to 220. So total pregnant females in the area will be 220, and there will be how many live births? 200 live births out of 220 pregnancies. So whenever they are asking you about ANC registration beta, very important for you to remember for your exam. Whenever they will ask you about ANC registration, it is always half of the expected ANCs. Of the total ANCs, you are going to get half. So बिल्कुल ठीक है. Some students got very happy, they answered 220. कुछ students ने बोला नहीं, थोड़ा और सबर, answer should be 110. But then nobody of you, आप में से किसी ने नहीं last word पढ़ा. पढ़ो तो सही. Listen to this word MCQ again. Listen to this MCQ again बेटा. लगा ना 220 वोल्ट का झटका आपको. लगा ना 220 वोल्ट का झटका या 110 वोल्ट का झटका. Listen to this MCQ again. देखो ध्यान से. How many ANC females are expected to visit the sub center in the same month? एक ही महीने में क्या 110 फीमेल आ जाएंगी? इतना क्या सबको शौक चढ़ा है कि सब फीमेल्स, every female will get pregnant and come for ANC only in December? So in the same month, how many females should be there? So at least, because the pregnancies, they will be spread out, na? So at least, are you getting it? So it is not 220. How many females should be minimum registered at any given time? It should be 110. Answer is absolutely correct. It is 110. It is not 220. 220 गलत answer हो जाता है बेटा. You always will have to divide it by 2. That is 110. Absolutely correct. Who answered it? 110. Up next MCQ. This was posted on the Instagram channel also. So this was posted on Instagram channel also. Please take note of this. Urban health facility targets a population of 10,000 with a crude birth rate of 20 per thousand. Same answer, same question. Calculate the amount of FIPV vials with each with the 20 doses required per month. Use a wastage factor of 1.1. 1.1 बेसिकली एग्जाम में ये क्वेश्चन छोड़ना था मानसी, तो फिर सारे क्वेश्चन छूट जाएंगे. ऐसे नहीं करना. This is all about race, but anyways, on the lighter side. Come to this MCQ beta. Calculate the amount of FIPV vaccine vials, each of 20 doses required per month using wastage factor of 1.1. Using wastage factor of 1.1. What do you think? So whenever the question will ask you the same question, whenever they ask you about the vaccine requirement, beta, vaccine requirement is given by the formula by the eligible beneficiaries, by the target population, किसको देना है, multiplied by the total number of doses, multiplied by the vaccine wastage factor or the vaccine multiplier factor. So who is the eligible population who will get which vaccine we are talking of? We are talking of the fractional IPV. We are talking of the FIPV. FIPV should be given to all live births. So technically you should be calculating the live births. You already know that live births is crude birth rate divided by 1000 into population. हमने अभी ये निकाला ना, so answer will be 200. So live births in the area will be 200. So what is the vaccine requirement? That is 200. FIPV की कितनी doses दी जाती हैं? The updated, we talked about this, the updated data is total 3 doses. Earlier we were giving 2 doses, but now the updated is 3 doses. Into vaccine multiplicative factor, that is 1.1. So it will be 600 into 1.1, that is 660 vials. So vaccines. So how many vaccine doses do you need? Total we need 660 doses. Okay. So now they are going to ask you that total how much vaccine do you need? 660 vaccines you need in 1 year. In 1 year. Okay. So total how many vials do you need? Each each vial has 20 doses. So 660 divided by 20, that is 330 आ गया आंसर. That is 330 आ गया आंसर. Right? Right? So that is not 330, 33 vials. That is total is 33 vials are required in full 1 year, in 1 year. So per month कितनी चाहिए? Per month, how many vaccines will you require? We will require at least 3 to 4 vials a month. We will require 3 to 4 vials a month. That is, total is, I hope you understand, right? So, right? I hope you get it, right? 33. Yeah, of course it is 33. So total vaccine vials that you will be requiring on month basis, that is 3 or 4 vials. I hope you can get this point, right? So if you have understood this point, answer should be marked as 3. Of course, 3 is on a lower side, but there can be some months where you might have some extra doses or you might need some extra vials. So 3 to 4 vials a month should be minimum given to the center. Let us move to the last MCQ before I close this session off for the day. It's already been 2 hours since you are hanging around with me and learning about getting tortured, I would say, about biostats and epidemiology. इतना ज़्यादा भी मेरे को बच्चों को टॉर्चर नहीं ना करना कि वो कभी मेरे को देखे ही ना, सुने ही ना कि यूट्यूब पे नहीं 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 हमने मुखमोहित को तो कभी नहीं सुनना यार, ये तो इतना बायोस्टैट्स पढ़ा रहा था, दिस वाज ऑल बेकार की चीज़, इट वाज ऑल समझ भी नहीं आया. एंड ऐसे डराना नहीं है मेरे को आपको. लास्ट क्वेश्चन ऑफ द डे, यू विश टू फाइंड द प्रेवलेंस ऑफ डायबिटीज़ इन योर डिस्ट्रिक्ट. Calculate the sample size with 95% confidence interval with an absolute error of 3%. Previous data shows prevalence of diabetes was 10%. Beta, if you want to leave this question, you are most welcome to leave this question, because there is no way you can do this question without a calculator until and unless you are very genius in mathematics. So this is a low yield type of MCQ. It was coming in INICET very highly in previous years, but since जब से computer वाला system हुआ तब से these types of questions have stopped coming. These are low yield, they are not very frequently asked these days, but पहले जरूर होता था, and because earlier it was there, student does not know and they tend to do these type of questions again and again. But आजकल these are not in trend, not in trend. Earlier they were in a lot of trend. So if you want to leave this question, you are most welcome to leave it. But इसका formula तो सुन लो मेरे से, that what is the, how to calculate the sample size. How to calculate the sample size. Beta, sample size is given by 4 into P into Q over L into L, or D into D. Some books will say D into D. It's the same thing. So 4 मतलब 4 होता है, P मतलब prevalence, Q means 100 minus prevalence, Q means 100 minus prevalence, L means the absolute error. L means the absolute error. So what is the answer you're going to get over here? So absolutely correct, it is 4PQ by D square, or L into L. So 4 into P. What is the prevalence they have given in this question? Prevalence कितना दिया है उन्होंने? The previous data shows that the prevalence is 10%. So this is 10%. 100 माइनस प्रेवलेंस कितना हो गया? 90%, है ना. एब्सोल्यूट एरर इन्होंने कितना दिया? इट्स अ डायरेक्ट क्वेश्चन विद एन एब्सोल्यूट एरर ऑफ 3%. सो 3% नीचे आ गया. सो इट इज 4 into 10 into 90 divided by 3 into 3, है ना. So 3 and 3 and 9 gets cut. So 400 is the best answer. Direct answer over here is 400. So what is the best answer you're going to mark? You're going to mark option number C as the best possible answer. And so with that, that was all from my side regarding most of the numericals, most of the important questions which you guys again and again ask me on Telegram group, on social media platforms. A lot of questions keep on coming. So that was all from my side. If in case you have any other doubts, or in case you want to ask anything, please feel free to ask me anything. And I wish you all the very best. And this was the last question. I think please discuss more questions. अच्छा लगा. बाकी स्टूडेंट्स बेचारे तंग आ जाएंगे इतने क्वेश्चंस हम डिस्कस करेंगे तो. So it's already quite late in the night. अब एक स्टूडेंट ने क्वेश्चन पूछा है, एक ये करके देखो, लॉट ऑफ टाइम्स क्वेश्चंस ये आता है. प्लीज एक्सप्लेन बाय नॉट बाय चांस कॉन्सेप्ट एंड इंटरनल एक्सटर्नल वैलिडिटी. वेरी नाइस. ये मेरे पास एक क्वेश्चन है. You can just try solving this. This question, you have done this again so many times till now. So you already know that calculate the 95% confidence interval. ये भी आजकल पुराना क्वेश्चन है. This is again a low yield. This time they won't ask you so much. But sometimes you should be knowing how to calculate the confidence interval. Calculate the confidence interval for a study on post-meal glucose in 100 individuals with the mean glucose 210 plus minus 10. So what do you think is the best answer? What do you think is the best answer? हाँ बिल्कुल ठीक है. Many people are answering 190 plus minus 230. लगेगा ना 220 वोल्ट का, 230 वोल्ट का झटका लगेगा अभी आपको. 230 वोल्ट का झटका लगेगा आपको. देखो ध्यान से. So this question is saying about the confidence interval, बेटा. Please note that the confidence interval is not the SD plus minus 1 SD 2 SD 3 SD. वो नहीं होता. Confidence interval का एक special formula है. It is given by the formula that is mean plus minus Z into SE. Okay. बड़ा easy है इसको. Mean का क्या मतलब है? What is the mean? Mean is 210. That is 210 plus minus Z. इस Z क्या होता है? What is a Z score? Z score is nothing but how much is the confidence interval you want to calculate. So question क्या पूछ रहा है? Look at the screen please. Question, what is the question asking? How much confidence interval? 95. So what is the Z value at 95? What is the Z value? Value of Z at 95. At 95, please note that you remember this was the normal distribution curve. You remember this was the normal distribution curve. Okay. This was the normal distribution curve. So this is what is 0. This is plus 1, plus 2, plus 3, minus 1, minus 2 and minus 3. So Z, what is the, my question is, what is the value of Z at 95% confidence interval? So 95% is at this point. So this is equal to 95% confidence interval, 95% confidence. So what is this value? Z कितना है? Z means the standard errors कितना है या standard deviation कितना है? It is 2. Okay, so that will be Z का value 95 पे कितना आता है? That is 2. In case the question was asking about 68, तो 68 में क्या लिखते हैं आप? Z at 68% confidence interval, it will be 1. Z at 99% confidence interval कितना आएगा? 3 आएगा. So यहाँ पे in this particular MCQ they asked about 95. So what will you write over here? 2 into SE. SE क्या होता है? SE is given by the formula standard deviation over square root n. शाबाश, very nice बेटा, very nice. SD by square root n किसने बोला? ये मेहुल दभलिया. Very nice. It is given by SD by square root n. So देखो SD कितना दिया हुआ है? It is 10. और total how much is the population they have given? N मतलब 100 हुआ ना. So if you look at this, SD is 10 divided by square root of 100. That is 10 by 10. That is 1. So that is 210 plus minus 2 into 1. That is 210 plus minus 2. So क्या आंसर होने वाला है? What is the best answer? 210 plus minus 2, that is 208 to 212. Absolutely correct. This is the correct answer. So that is the way to calculate the confidence interval. इसका formula बस आपको याद रखना है. What is the way to calculate the confidence interval? Confidence interval is the proportion या फिर mean जो भी एग्जाम में दिया है plus minus z into standard errors. ये आपको याद रखना है. This is the way to calculate the confidence intervals, right? Some student had asked about internal and external validation. What do you mean by internal external validation? Internal validity and external validity. Beta, if you do a research, listen to it very carefully. If I do a research to find the effect of maybe salbutamol in COPD patients, use of salbutamol or salmeterol or long-acting beta-2 agonist in COPD. So if you want to use any of the salbutamol or LABA in COPD, I do a research. Okay. Let us say I do my research on 100 patients in my small town of Chandigarh. In Chandigarh, we are doing this study on COPD from, there's a small medical college called as PGI Chandigarh. So I do the study over there in PGI Chandigarh using COPD patients whose median age was 72 years. Let us say this is actual real life story I'm telling you. So salbutamol was assessed in people, 100 patients whose median age was found to be 72 years in a small town in PGI in Chandigarh, in PGI Medical College or PGI Chandigarh. And then if you come to Chandigarh, or if you try, now this was the study which was done by me. You come to my same place and you do again a study in Chandigarh only. You come to my place in Chandigarh. I did a study over here and you also do a study, you find your answer. If your answer and my answer are very near, this means that my study and your study, because your result was also equal to my study, that means my study had good internal validity. What does it mean, internal validity? That means internal validity. What does it mean? That means the results, can be replicated in similar studies. That means in similar situations, in similar type of drugs, in similar type of population, in similar type of demographics, and similar type of diseases, your study will be having a good repeatability, that is internal validity. That means it is robust. That means there is less bias. I hope you understand this understanding. Internal validity. What do you mean by external validity? Now, if I do my study on 100 patients with a mean population age group of 72 years, can you expand my whole answer of my study onto Italian population whose mean age could be 64 years, or if I put this whole to Bangalore population whose mean age is only 42 years? Is my study replicable on a larger scale? Is my study replicatable on a larger scale? That talks about external validity. External validity, it means what? MCQ. External validity, it means generalizability. It means, is your study generalizable to a bigger population or to different situations? Can it be taken to Japan? Can it be applied to the population in Tokyo? Can it be applied to population in Denmark? Can this study be scaled up to the whole population from India? Can we do that? Is your study having good external validity, or is your study having good internal validity? Internal validity talks about how robust your study was, less bias. External validity is it is dependent on many things. It is more dependent upon the sample size. It is more dependent upon the sampling frames. It is more dependent on so many things. That is what is external validity. Do you understand this point? It's a very important point, probably for PG students to know, but it has been asked so many times in your AIMS exam, in your INICET exams also. So I wanted to talk about internal validities and external validities. So that was for you, Dark Knight 08. Can you explain not by chance concept? See, let us say I take this example all the time in my classes also. Whenever I'm there for the classes, I take this example. Just look at the screen. Let us say I ask you, what is this? What do you think is this? So this is a pen. This could be a stylus. This could be a pencil. This could be anything. Okay. So if I do a research, I'm trying to explain you chance effect. The p-values, alpha errors and all that. So if I tell you that the p-value comes out to be less than 0.05, it comes out to be 0.02. It means what? It means, beta, that there is 0.02 probabilities, or p-value 0.02 means there is 2% chance or 0.2 probability that this result I found it just by chance. So the lower the p-value, lower is the p-value. The lower is the p-value. This is a very 5-star statement that I'm going to write. It is as low as the p-value. The lower is the p-value. That means there is lower chance of finding the effect just by chance. In other words, your result is more confident. It is more, your result is more confident. You are more sure about your result. So the lower p-values 0.0001, that means highly significant. Are you getting this? Lower is the p-value. That means you will be more confident that yes, remdesivir is useful in COVID-19. So if the p-value is 0.00001, that means you are more confident. If the p-value is 0.02, that means compared to that 0.0001 value, you are less confident. Are you getting it? So lower is the p-value. That means lower chance of finding the effect just by chance, because you can find the effect just by chance. I ask you a very difficult MCQ. ध्यान से सुनना. Let me change the whole game. Let me say I ask you a very difficult MCQ. I ask you a very difficult MCQ like what do you mean by Yates correction? What do you mean by what is Yates correction? बताओ, नहीं पता ना? One of the student खड़ा होके बोल देता है, one of the student खड़ा होके बोल देता है कि सर Yates correction can be applied where the sample size is very low. If the sample size is very very low, you can apply Yates. अब by chance ये भी हो सकता है ना, उसने by chance answer कर दिया because he was listening to someone and they were talking about Yates correction. So try understanding what I want to bring the point over here is that you might get a correct answer, but that is chance effect. वो गलती से सही आ गया. That is what is the p-values. P-values means lower is the p-values, the more sure that you are answering because you already knew it or you actually found it. So if the p-value is, if the p-value is 0.0001, that means there is less probability of finding the effect by chance. Are you able to get this? Or there is very less probability of finding the effect by chance, or there is less probability of getting the errors over here. That is what this chance error means, right? So that was for you. किसने पूछा था ये? Mehul Dhabalia. That was for you. Thank you so much, Drowsy Hobbit. And sufficient component cause, beta, it's not at all required. Sufficient component cause I have discussed just in the recent INICET exam recalls. It is available on the YouTube also. I don't want to waste anybody's time in talking about the same story again and again. Sufficient component cause. It has already been discussed in the INICET recall MCQs of 2022. So just visit YouTube, you will be able to find that and this video and see about the sufficient component cause parameters. And just for brief understanding, it means that if this is happening of the disease, people may get myocardial infarction or coronary artery disease because of maybe hypertension. It could also be because of lifestyle. It could also be because of nutrition. It could also be because of more sweet. It could also be genetic. You can have so many factors now. So which factor is enough to cause a disease or which is there in everyone? That that concept is given by sufficient component cause. For details, you have to visit this YouTube video INICET Recall 2022. एक दफ़ा वैक्सीन्स बता दो. वैक्सीन तो टॉपिक हैज़ बिन डन विशाल शर्मा. इट वाज डन आई थिंक लॉन्ग टाइम बैक. वी डिस्कस्ड अबाउट वैक्सीन्स एंड मदर चाइल्ड हेल्थ. टुडेज टॉपिक वाज अबाउट मेडिकल रिसर्च, एपिडेमियोलॉजी एंड बायोस्टैट्स. सो FMG के लिए कब मैराथन करोगे? मैराथन FMG के लिए इट्स ऑलरेडी अवेलेबल ऑन यूट्यूब. आई हैव डन too many FMG marathons. It's already available. You can watch that. It's a full complete PSM in 3 hours, complete PSM in 2 hours, complete PSM in 7 hours. ये सब available है. So with that, I'd like to thank you so much for attending this whole boring topic about epidemiology and biostats. और जाने से पहले बस मैं यही आपको बोल के जाऊंगा दैट देर इज़ अ टेलीग्राम ग्रुप. इन केस यू हैव नॉट जॉइन द टेलीग्राम ग्रुप, प्लीज़ जॉइन द टेलीग्राम ग्रुप. टेलीग्राम पे वी आर डिस्कसिंग ऑल द डाउट्स ओवर देयर. All the doubts are discussed on the Telegram. Instagram is mostly for updates. Of course, in case you are a Marrow subscriber, you have a beautiful application and you have a beautiful platform of the Marrow Links group on Facebook. So Marrow Links group on the Facebook, you can shoot any doubt over there and we'll be there to answer you. And that was the week number 4, and today was probably the last week of the technical session for a quick review of PSM for your upcoming INICET exams. And thank you so much for attending all these 4 sessions. I've tried to discuss full epidemiology, full PSM, full community medicine in these 4 sessions of communicable disease, mother-child health, vaccines, nutrition and epidemiology. In the next session, we might discuss just briefly about some of the image-based MCQs. So Telegram group अगर आपने join नहीं किया, you should seriously consider of joining the Telegram group. It is MUKHMOHIT, Mukhmohit's Community Medicine मिलेगा आपको group का नाम. And it is PSM booster भी वहाँ पे मिलेगी. No, there are no more updates in PSM booster. It was just updated recently. And please join that, and thank you so much, and make sure that you keep your focus right. अपना focus अगर आपका ठीक रहेगा, you will achieve what you want to achieve. Okay? So कहते हैं ना कि अगर राजा बनना है तो नौकर जैसे काम करना पड़ेगा, उतना आपको संघर्ष करना पड़ेगा, उतना आपको एफर्ट्स लगाने पड़ेंगे. सो इफ यू वांट टू बिकम द किंग, यू हैव टू वर्क लाइक अ पेजेंट, यू हैव टू वर्क लाइक अ सर्वेंट, एंड दैट्स व्हाट यू आर सपोज्ड टू डू राइट नाउ. यू जस्ट हैव फ्यू डेज रिमेनिंग फॉर योर INICET एग्जाम. Make sure के you're not preparing basically for your exam. You should be preparing that what are you going to do in your last 15 days, 20 days before your exam. So these days are very, very crucial, very, very ultra crucial, and you have to spend them wisely. Okay, so video will be there till your INICET exam, because this is purely for INICET exam. All the very best, and have a good night. Thank you so much.